Welcome back. The point in the government shutdown is the Affordable Care Act tax subsidy set to expire at the end of the year. Democrats are demanding they be extended before they vote to reopen the government. And now, with open enrollment already underway across the country, people with ACA plans are starting to get a sense of what they'll pay without those tax credits in place. Politico notes that some enrollees who live in New Jersey, for example, will see their out-of-pocket premiums rise by more than 175%. In Colorado, it's 101%. Health policy organization KFF estimates that users on the healthcare.gov website and in-state run exchanges will see their premium payments increase by 114% on average. And joining us now is one of the principal authors of Obamacare, Yvette Fontenot. She is the former deputy director of the Office of Health Reform at DHS and now the CEO of Impact Health Policy Partners. Yvette, it's great to have you with us. Can you help us understand why these price hikes vary so much based on location? Why are we seeing these huge disparities in premiums across the country?
Yeah, it's a good question. So it really depends. Health insurance costs depend on where you live, because pricing is different depending on where you live. Hospital pricing, drug pricing, it all varies depending on where you live. So these premium tax credits, the enhanced credits that were passed as part of the American Rescue Plan during COVID, really help buy down people's premiums at the lower income levels, middle income levels, and for higher income people, capped their premiums at 8.5% of their income. And as those expire, depending on your income level and depending on where you live and the underlying health insurance costs, your premium impact will vary. But as you noted, on average, across the country, it's about 114%. And for particular states that have seen increased enrollment in the marketplaces for various reasons, like Florida, North Carolina, Texas, Georgia, those premium impacts as these enhanced tax credits expire are going to be significantly higher than in other areas of the country.
I'd love to have you expand on that, because KFF finds more than 20 million Americans who get their health insurance coverage through the ACA will see their premiums more than double. What are your biggest concerns if these subsidies are not extended? What parts of the country could see the most impact?
Right. So as I noted, during the American Rescue Plan, when they added these enhanced premium tax credits, we saw an increase in enrollment in the marketplaces. So about 24 million people enrolled in the marketplaces now, which drove our uninsured rate in this country down to historic lows. If these enhanced premium tax credits expire, that we will see about 10 million people lose their health insurance because of the Medicaid cuts in the Republican reconciliation bill, and then an additional 5 million lose their marketplace coverage because of the increase in premiums. And since the enhanced premium tax credits were added, more than half of the national growth in enrollment has been in those 4 states that I just mentioned: Texas, Florida, Georgia, North Carolina. And about 80% of all the premium tax credit dollars, about $115 billion worth, went to marketplace enrollees in Trump-won states. So these are really areas where you've seen an increase in enrollment because of the enhanced tax credits that will be most significantly affected if they are allowed to expire at the end of this year.
And as we've been discussing for weeks now, Democrats have tied reopening the government to extending those ACA subsidies. Here's what President Trump just said last night on 60 Minutes.
So you're saying your plan is to tell the Democrats to vote to end the shutdown?
Correct. Very simple.
And that you will put forward a health care plan?
No, we will work on fixing the bad health care that we have. Right now, we have terrible health care at too expensive for the people, not for the government, for the people.
But, Mr. President, with all due respect, you've been talking about fixing the health care insurance plan since 2015.
And you can't do it because of the Democrats.
But since 2015, you've said you'd fix it.
I've been talking about it for a long time. We almost did it. We were 1 vote short. We would have had great health care.
Do you have any idea what their plan could look like? Are you tracking any plan to replace Obamacare? And honestly, what would it take to replace it at this point?
Yeah, we've been waiting on that plan for quite a while. As folks may recall, in 2017, There was a plan that was put on the floor, and Senator McCain was the deciding vote in not repealing Obamacare at that point. Since then, we have not seen any kind of plan to replace what people have right now. And frankly, if nothing happens by the end of this year, then 20 million people, as you noted, will see their premiums double. So I don't see where there's amount of time to actually negotiate a plan, contemplate a plan in the next couple of months, since we haven't seen anything since 2017 to actually affect what people are about to feel in the next couple of months, on top of everything else that they can't afford in the economy right now.
It's all complicated and layered. Thanks for helping to explain how it works and why these subsidies matter so much. Yvette Fontenot, we appreciate it.
Thanks for having me.